A lot of patients ask us what kind of instruments we use for endoscopic slip disc surgery or endoscopic lumbar spine surgery. So let's see today what kind of instruments are available with us and how we use them. So first of all, supposing if we have to do a L4-5 slip disc surgery, so we first of all position the patient prone on an operation table and then we mark the L4-5 level. Then we give a very small incision over the skin, which is smaller than my fingernail. Basically it is less than 1 centimeter. Normally we give 7 or 8 millimeter cut in the skin. And then we put dilators or serial tubes like this to dilate the muscle. Important thing to note here is that we do not cut any muscle during this surgery. We keep on dilating the muscles by putting in sequential dilators like this. We keep on putting the dilators. We keep them putting one over the other, and slowly the muscles, they start moving apart. Once we reach the bone or we reach the required disc level, then we put inside a scope like this. So this is what a scope looks like. This is normally 7 to 8 millimeters, and through this the entire surgery is visualized. Through this only we are able to put different instruments, and those instruments slowly we create space for the nerve. Now supposing if we reach the area and there is some amount of bleeding, then using a cautery like this we burn the blood vessels around that area so that we stop the bleeding and the vision is clear. Then sometimes we may have to shave little bit of bone also while doing the surgery. So we put a burr, which is basically a rotating instrument that selectively shaves very minute amount of bone so that we can create some space for the visualization of the nerve. Now once we reach that area where nerves are there, then we slowly identify the nerve and put a hook like this. Through this hook we retract the nerve onto the sides, and then we visualize the disc fragment which is there, which is pressing the nerve. Now once nerve is secured, we are able to see the disc fragment. Now we use an instrument like this. With this instrument we protect the nerve and we reach inside the disc fragment. Once we reach near the disc fragment, we use graspers like this. Grasper is basically a forceps like this, and it can hold the disc fragment. So we use this type of grasper to remove the disc fragment, and when we take out the disc fragment we check the nerve again, and that is the end of the surgery. So this entire surgery is done through an incision which is smaller than 1 centimeter, normally between 7 to 8 millimeters, and through this small incision only the entire surgery is done. Thank you.